Okay, we'll come in session if you stand for the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
If you'd remain standing for a moment of silence, please.
Please remember the 6 firefighters and 16 police officers we've lost since our last board meeting, and keep in your thoughts those folks affected by the hurricanes and earthquakes.
Thank you. Okay. Open the meeting for a public forum. John, we have anybody who wants to speak?
We have not received any requests to address the board.
Okay. Consent agenda. I'll just make the motion. We approve the regular board meeting minutes from August 16th. Is there a second?
Second.
Any discussion? All in favor?
Aye.
Okay, financial report.
All right. Thank you, Chief. Mr. Chair, members of the board, you have the August financial report in your packet. Starting off for the month of August, we did receive, $25,064 in property tax revenue. We projected $35,000 for the month, so we're only off by about $10,000. Our non-levy revenue was actually quite impressive for the month of August. We received $417,000 in non-levy revenues compared to the budget of $187,000. Both ambulance revenue and wildland revenue were the biggest reason for that variance, and that's carried through in July as well. So you'll see that when we get to the year to date. Personnel costs were slightly under budget at $917,000. Vehicles and equipment again under budget at $51,892. Utilities and communication were pretty much right in line with budget at $25,248. Managerial for the month was under budget at $60,995. And that's just timing on some like audit expenses and things of that nature. And then capital and contingency was at $168,532. For the month, our total expenses were just over $1.2 million, which was under our budget by $132,000. And one thing I want to point out is while $132,000 under budget sounds like a large amount, we're actually within a less than 1% variance of our budget. So when you actually look at what our budget is and what the actual total percentage of variance, it's less than 1%. So we're much more dialed in on kind of the timing of expenses and reducing those variances from our budget to our actual. When we look at our fiscal year to date, you'll see total revenue is at $710,521. We are again slightly under our timing on collection from the counties. However, it is wildland and ambulance revenue that's pushing us over our year-to-date budget. Personnel under at $1.6 million. Vehicles and equipment are under budget at $99,000. Utilities and communications are still trending kind of right in line with budget at $41,316. Managerial, again, when we kind of look at the year to date, is slightly over at $241,000, and capital and contingency is under budget at $209,000. Total expenses year to date are just over $2.2 million, which is under budget by $486,000. And again, that one's a little bit higher, but we're still within less than a 2% variance on our budget to actual. So again, much closer on our timing of our expenses. Yes.
Is it possible or even feasible to add a single bar to these two bar graphs that would reflect the total for that given month? In other words, you described it.
Yes, I will do that.
Because it doesn't, at a glance, especially for the public that may
Let's look at the graphs.
Yeah.
Yes, so what I could do, and what we've already started doing for other clients is having total revenue, and then the breakdown, and then total expenses and the breakdown.
So we can see for that given month that, oh yeah, for the month of August, we are under or over.
Yes.
And the same for the fiscal.
Of course.
Thank you.
Yes. Anything else on those? Percentage of expenses, personnel still being our predominant expense at 74%. Capital and contingency is next at 9%. Operations at 8%, and managerial at 6%. Finally, when we kind of look at a year-over-year cash position and where we stand, we ended the month at 3.1 million in cash compared to 2.5 million last year this time. Realize though, in addition to that, we had that large payout for PSPRS that we are essentially getting a credit for the portion of our payments that we would be making to PSPRS this year. So we will actually see our cash position improve, which is one of the goals kind of we slowly set out to do when you first engaged with my firm, as well as some of the things we worked on as we've talked about kind of future planning and looking forward. The only other thing I just want to kind of point out on the PSPRS thing is we still are, they're still working through the process on being able to report, because as part of the payout provisions, we are to still pay the employee contributions. It's just the employer contributions we're not required to pay. That's essentially what we prepaid by paying it out to the employees already. But PSPRS is still getting things worked out with the new legislative changes in their reporting systems. So until they have that worked out, we still haven't actually made any PSPRS payments, even on the employee side this year. So that's just kind of a little something else I wanted to point out to the board on the PSPRS front. Still at this point, no determination on the interest portion of the payments, but that is supposed to be forthcoming. So we'll see when that comes out. Only other piece I want to add on the finance is Pam's been working really hard on getting the books closed for the audit. The auditors are scheduled to be here next month. I'm trying to narrow down a date on when Jay Park, the partner, will be here, and there will obviously be a time, as always, when a board member comes in to interview with him. So, unless there's any other questions, that concludes the August financial report.
Okay. Thanks, Gabe.
Thank you.
Any questions? Otherwise, we need a motion to approve.
I move to approve the budget for August of 2017.
Second.
Okay. Any further discussion? All in favor?
Aye.
Aye.
Okay, Chief.
All right, Board, looking at our annual, our monthly report, year-to-date, where we are, you can see in the rescue, EMS, and interfacility columns, we're trending under. We just did a little bit of review on our policies and changes in policies with the hospital, and some of those interfacility reductions are based upon recent protocol changes. The people that we're transporting from the village are now primarily going directly to VVMC, and so we're eliminating some of those places where we would take them to SEC and then transport them down to VVMC, and so that's why we're seeing a decrease in those numbers, as well as I believe our CIP program as well is making some impacts. While anecdotal at this point, I think those numbers are down. But if you look overall across the board, we've actually surpassed where we were last year this time just by a couple calls. But if you recall, we were trending under up until this month for a while.
Is that discretion of the hospital or our discretion that we're not going to?
The hospital, medical
they
direction.
Want to divert around.
Well, with the help of Ed and Ed, if you want to speak to that, use the mic.
We've had many iterations from different medical directors on where and why we transport and what our destination is. And with working with Dr. Shank and pouring through our data, we requested, hey, can we let our medics decide? We're seeing a lot of the two-step stuff. And so he freed it up. And with traffic and a lot of the other things we've talked about, it's quicker sometimes in the village to get them to Cottonwood, to definitive care versus coming to Sedona. And our medics will still transport from the village to Sedona Emergency Center based on diagnosis, but it's the proof's in the pudding. It's the numbers show that it's an efficient way to do it. And so it was a partnership with the NIH to say, hey, we want to try this. And
So it's all about patient outcome. It's all about quality of care. It's all about quality of life issues. And so, certainly talking to people, it is disruptive to have that two-step piece, if we can avoid it when we know and can do. So proud of our folks for being there and doing that. And the numbers show that it's beneficial for the patient. Looking at the numbers there, actually we had 152 responses, emergency responses, the most out of the entire year, with an average of 6 minutes and 3-second response time. So that's impressive there. And overall, our response times are down to more incidents. So that's a trend in the positive way. I'd like to see that, and all about response. 10 backcountry rescues. We continue to be busy in the backcountry rescue stuff. I think it seems to be about 10 a month we're doing as a general rule. We talked about the rescue we did yesterday on Bell Rock and a helicopter rescue, so we continue that as a pretty busy thing, and it always will be while we're here in Sedona, I think. So, any questions on the call summary? Looking at the
I
grant.
just have a comment, because I think it's really excellent that we're having more, being given the permission to have, or authority to have more discretion about where we take our citizens, and it saves them time and it saves us money.
Excellent. All right. So grants, updating the grants. I just got a text message confirming we did get the grant, and the hazmat equipment tools that are listed there on the grant, they came in. And so that is funded and provided. So we've got monitoring devices that we have, and saved us almost $5,000 worth of expenses that would have been purchased out of our general fund. The FEMA grants, we're waiting and waiting and waiting. Just looking for pens. Still waiting. I don't know. I'm not sure that's good or bad, but we'll have something eventually. They will close out eventually and say that we got it or we didn't. And then the names grant, Chief Missoula sits on the names committee and was able to apply for a grant, $6,000 worth of matching grant. But we were putting on a class. They liked what we were doing, and Ed wrote a grant, and they were willing to fund us for $6,000, which was half of the class. And so we've already been getting people from Yuma and all over the state that are interested in taking this class on documentation in December. So good on Ed's part to reduce the cost for our people. And
Check was delivered today.
check was delivered today. So again, saving us $6,000 worth of training costs that would have been that were budgeted if we didn't get the grant. So good stuff there. And then Walmart provided us $800 worth of car seats as well, and so those were picked up, or I don't know, they're picked up yet?
They have not come in yet.
Okay. So grants are grants. We keep applying and do what we can do, and good stuff. We're working on the documentation and the right graph to give you the response by stations piece, but we talk about that and it will be done. You see some nice donations that came in there, and for a total of $500. Well, not donations. I think it's important to note right now, Captain Fleece is on light duty and has been working feverishly. Is that the right word?
Fanatically.
What's that?
Fanatically.
Fanatically, okay. Feverishly, fanatically, to go through all of our surplus equipment. And he is determined to clean out 60 years of collecting stuff. And we put it on the public auction site, and we are selling things. I believe Board Member Konarski talked about doing that in one of his past lives, and very successful. I don't have any numbers on what we brought in for added revenue, but we're selling stuff, and people are buying stuff, and it's great because it's leaving our building, and it's not hitting the garbage, and it's making us a little bit of revenue. But Captain Fleece needs to be recognized for his hard work and his feverish pitch. Community risk management, John, if you want to grab
Another busy month in CRM, and thank you. Another busy month in CRM. We've been slowly transitioning, like we talked, focusing our efforts more on the assembly occupancy and residential occupancies. So we're making headway there. Chief mentioned the grant that we got for the car seats. That has been fairly busy for us too. We've done 2 car seats this week, so 2 car seat installs, so that's a good thing. Lots of stuff in the pipeline. I think we talked last month about some of the hotels and multifamily residential units that have been proposed. Still working on those. Nothing new in the pipeline since then.
So we have a total of 3 hotels in the pipeline, or potentially?
Four, I believe, plus an apartment building, and a couple of new restaurants that are opening up, basically infill restaurants that had closed. But
So
yeah,
lots
lots
happening.
of stuff going on, never ending.
So we're excited, starting next month, we'll have firefighter Eric Walter be taking over the CRM, CIP, fire inspector, what do you call them? Community Risk Reduction Specialist, who will focus on both CIP and fire inspection stuff. So that's, again, helping with the backlog that Fire Marshal Davis and his team have in the fire inspection world, as well as the great stuff that Division Chief Mazulis is working on with community integrative paramedic programs. And we've got how many patients right now?
We average a steady 5. We had 7 at the beginning of the week, couple discharged, but it just that's sans any great efforts to reach out to primary care providers, the public, or any sort of advertising. And NIH just spent the dollars to build the pamphlet. They're re-educating their care managers within the hospital system, and then they're starting to reach out to primary care providers now, and so it's steadily increasing the numbers.
I'm seeing some good stories come out of the work you're doing as well. So, you know, again, improving the quality of life for our people out there. And we're testing the waters on some revenue streams as well. Is that fair to say? Testing the waters?
It's fair to say that we are currently speaking with NIH about an intergovernmental agreement that would be a shared revenue stream based on home visits through the ICD-10 codes, or 9 and 10 codes.
That would be fantastic. Who is providing the service right now, going to the homes?
Me.
That's what I thought. I just wanted to know if that was still the case.
I thoroughly enjoy it. I've met some of the coolest people in town doing it, and real rewards have come from the program. And we've kind of been on a bumpy road with all the partnering agencies. Not a bad bumpy road, just it was unpaved and uncharted. And now we've really started to formalize the plan. A couple of the folks in the program with Verde Valley Ambulance are going back to speak at the Cerner conference, which is the software package that provides the EMS documentation we use for community paramedicine. And so our collective program's being recognized, and it's growing a little faster than I was prepared for.
Well, I'm glad, and how wonderful for the citizens to have that continuity of care of you seeing them specifically.
In the training side of the house, we continue to provide training as a high priority for our folks. We're proud, if you remember, a year or so ago, we had the opportunity to pin Adam Derringer as one of our firefighters, and his grandfather was a fire chief here, if you recall that. Anyone remember that?
Oh, yeah.
So he finished up his 12-month probation. At the end of your 12-month probation, you have to take a written test and a practical test. And he's the first person to ever score 100 on both of them. Actually, 100 on either of them, but he actually got 100 on both of them. Pretty impressive stuff. Good, proud moments for us as an organization, and certainly as him, and I'm sure as his grandfather is proud as well. So time flies. It's hard to believe it's been a year that he's already been in the system and now off probation. Pretty neat. You saw last month we swore in some folks. We've got them on the floor now. They're part of the response, just finishing up their 3-week orientation, and then now they're on their month where they're with their crews and getting their training on the fly, and they'll be part of the staffing here shortly if they're not already, almost right about now. So, and then we're excited. We actually have some other openings through some people that have left and things of that nature. Captain Fleece actually has announced his retirement. So we have 3 more firefighters to fill vacancies that'll be starting next month. So it's been a busy year here at Sedona Fire. So that is that. Speaking of new firefighters, the first thank you, well, not the first thank you, the second thank you I have, but while I'm on new firefighters, it's actually at the back of your packet. 3 of the new firefighters during their first week of training were coming back from doing some drills, and one of the neighboring businesses behind the fire station were struggling to carry in something, get into their car or whatever, and all 3 of the firefighters on their first week, without even getting the formal customer service training, ran over, helped the citizen business person get their problem taken care of, and that person was nice enough to send a letter and share the story. And as I got it, I thought, it's got to be the three of the new guys. And sure enough, it was. And it just was a proud moment for me to know that when the hiring process we put people through really looks for the cream of the crop, and to have not even given them the here's what we expect of you story. When you help people in our community, they already had that. And that was pretty reassuring for me. So pretty cool that the new guys had that already in them. Thank you letter from Christ Lutheran Church. We actually taught them a CPR class to some of their folks. Unfortunately, or fortunately, a few days after the CPR class, one of the people that was in the class had their spouse collapse down in Green Valley, and they were able to perform CPR and provide some success in doing CPR for their family. Well, the outcome ended up not being ultimately successful. It did provide some opportunities for families to make it in and things like that. And so the pastor Brandfist, who's just a great neighbor of Station Number 6, shared this story with us and was appreciative for the folks who taught his congregation some CPR. So good stuff there. Just an interfacility thank you. You see there another thank you from someone that we treated and took care of, and then the recruits there. So. And then certainly the lady on the last lady, Lenore Kerr, you read her article in the newspaper, and I saw the caretaker the other day at a meeting, and she said Mrs. Kerr was so appreciative that our folks cleaned up the soup that she had spilled and dropped all over her, and never expected us to go to that limit or to that level to provide that service. And so again, as the fire chief, I certainly know that our folks are out there doing great stuff each and every day, at every moment, and that's all you can really ask for in my mind, and so very proud of them for that. Any question on the fire chief's report so far? All right, just a couple of the updates of recent activities and things like that. The bond election, as we know, is coming up November 7th. We'll be, I'm engaged to speak at numerous different service groups and different things along the way over the next couple of weeks, months. I don't have anything else to report on the bond unless you have any specific questions about anything related to the bond. Cottonwood Public Safety, anything, we got I think the MDT stuff was on their agenda the other day or next week.
The agreement that you passed about 2 months ago now, that we had to have some rephrasing of a sentence or two, was finally finalized by the city of Cottonwood, and now they've moved the ball forward relative to setting up meetings to begin the implementation process for the mobile data terminals and the fire engines, to have that go live. So we just received that today.
Well, congratulations. So I don't want to repeat myself too often, but when do you see them being installed?
I'm not gonna,
I said, come on, push them. We're working hard at that.
yeah. So
High priority.
So it's a function of getting the Cottonwood team together with our IT folks who are under-resourced at the moment with a number of things that they're challenged with, and trying to fit it into the schedule. It's great to see that Cottonwood their IT director is moving forward quickly on it. It's just a matter of our team on our side to get caught up on some other things to now move into the MDT realm. That's been waiting on our side, well, as you know, for a number of months.
Is there been any thought to contracting that out?
Yeah, it's, as you know, our system is unique,
Yes.
and it has a lot of tailored instruments and continuity pieces into it that don't necessarily allow for a vendor friendly environment. So it's going to be reliant upon Bob and his team to really sit down and break the time away after they get some of the critical infrastructure pieces taken care of. We had 2 towers have equipment failures, which caused them to go out, and we're working with Sedona Police Department, who we contract services to provide communications infrastructure with. They're going through an upgrade right now, so we have some things that are already planned and pipelined in that we're working on.
Thank you.
So I I'd love to give you a date,
Right.
but
Well,
my
it
June
sounds
deadline's
like-
already passed, so
Sounds like there's a lot on the plate.
yeah,
Yeah.
we're
But
trying.
look forward to hearing that announcement.
Me too.
I think, Board Member or Clerk Cooperman, the message there is that it's a constant, there's constantly stuff happening here, and every time we have it all figured out, if you will, I'm thinking June's probably a date, things happen. It's not that anyone's not doing, 110%, it's just things happen, and there's a lot of complexities in a lot of things we do. And so it gets, it's prioritized high, it's on the list. I certainly am knocking on Jeff's door often, like, where's it at, where's it at, where's it at? And so we know it's important, but just understand that everyone knows it's important, and we're working hard, and everything else that's also important, such as the other day, station number 4 calls and says, hey, we're walking to the cars in the parking lot, and we notice that all the there's water seeping out of the asphalt as we walk out the front door. We think there might be a water leak. So there is a water leak. The water company came out and said, yeah, we got to cordon off this area. We can't have anyone walking on it, driving on it. And so we've got a fairly could be substantial leak at station number 4. And we're waiting. And anything else, Jeff, you want to say about that you know
Yeah,
specifics?
all the underground has been striped by the contractors, and we're hoping that when the backhoe takes the first few shovels out, it leaves all the critical infrastructure around it alone. 'Cause there's a lot of cabling and fiber optic T1 lines and alike from the communications center and from the phone company across the street.
CenturyLink?
Is
you.
the
Cen-
break
Central.
on their, is it on Arizona Water's money, or is it,
We're gonna find out when they dig it. It's our water meters are on the concrete side of the break. You can see the water seeping through the asphalt. That's just to the west of our meters, which is just shy of their street meters or street key valves. So we'll see when they start digging it up. We know the vault out front that holds a lot of the communications equipment from the phone company is full of water. So it's clear, and when there is a sewer line that runs through that space as well, it'll be fun to see what happens when they start pulling dirt out of the hole. But it's about a 20 by 20 area that they have marked out to be excavated.
Chief, is this in front of the apparatus floor or apron where they would have to?
It's in the driveway going on the side of the
Okay,
fire station,
gotcha.
back to the parking area and where the tower is. So it's between the annex and the building itself, fire station.
looks like, we can't, rebuild too soon for Station 4.
Old stuff breaks, yeah.
So those are the type of things that just continue to happen, and we work through. I'd like to talk about the 9/11 observance ceremony that we had. Board Member Soto, you were there. If you'd like to share any words.
We had a pretty good turnout, to say the least. We had, I think, more people than we anticipated
Definitely.
for a non-anniversary date type of thing. Well presented with the speeches given, and well appreciated by the community who attended, including myself. So it was a job well done. Thank you.
Certainly. So there were probably 75 people or more that were there. The speeches were, well, it was a quick 32-minute ceremony. So I think it served its purpose. The 9 o'clock in the morning time was nice. It wasn't too warm. Lots of good feedback from the folks that we talked to. So that was good. I certainly want to recognize Board Member Soto for some work on a flag case and plaque and a couple other things that he graciously donated his time and money and effort to put together. So kudos to Board Member Soto for continued woodworking skills and just dedication to details. So thank you for making that event what it was. And certainly the Sedona Verde Valley Honor Guard did a great job presenting the colors as well. And we actually had one of the members, not a Sedona firefighter, but sing the national anthem and did a fantastic job, I thought, singing that as well. So represented well across the board. So that was that. A wildland update. I'd just like to see if Chief Vice Chair could just give us a quick wildland update. We're kind of winding down a little bit, but maybe not. See what California does.
So we have all but one person back from our assignments. The engine came back this weekend and with 4 personnel. So they're recycling. We've got one overhead person on a fire up on the Columbia River, just east of Portland, who's finishing his assignment. And then Chief Coyle's going to head back out to finish a project for the National Mobilization Committee on risk management pieces that he and partner Todd Abel from Central Fire have been working on for helping fire teams assess risk and develop plans based on such. And then Southern California is just getting ready to burn now, and so it's the season keeps on giving. A lot of moisture recently up in the Northwest, which has kind of slowed things down and set things up. For a reference point, I've been in the wildfire system since 1979, and there's been 3 occasions in my career where I've seen the nation at level 5 in preparedness level, which is the highest, and having to go through such a long duration. It's almost been a month and a half they've been at level 5, and it's just been a really long, arduous fire season for the nation. And then you throw in some hurricanes on our southern and southeastern borders, and now our eastern border with the other hurricane. I think it's Jose.
Maria.
Maria.
Well, Maria's up, or there's one up on the east coast.
Oh,
Jose.
is Jose still
So
hanging?
it's, FEMA's tapped out. They've actually been calling through our county emergency services group, asking for people to sign up to become available for hurricane response and recovery. So it's an interesting season, if you will, between fire, hurricane, and whatever else may come forward. But our folks right now are in a rest cycle, if you will. Our folks have been covering shifts, extra shifts, while people have been out, and as well as folks that have been out. But we'll be ready to go here in the next week or so when people are reset and ready to move forward when the next emergency or demands require. And Chief Mazulis actually took a team of folks out to Katrina, was it?
Yeah, we went out.
To Katrina for flood rescues when that occurred. And so we foresee those sorts of things occurring now again as the FEMA USAR teams get strapped and stretched thin. The incident management teams that are national teams for wildfire generally, but they're all risk. Chief Coyle's on one, as well as
Sean
Foster. And we've got some folks that fill in some gaps and spots. They're actually trying to pull Chief Coyle's team into Puerto Rico for recovery efforts there. And so it's just going to keep on challenging the emergency services in the nation. And Sedona Fire is engaged to the degree that we can be engaged while still taking care of things at home. And we try to seek that balance. Good news is on the financial side is we get full cost recovery for those pieces, and the finances show that payments are coming in timely, quickly, and we're not having to finance those efforts from our coffers.
Currently, our budget's $55,000 worth of revenue. In fiscal 18 that we just started July 1st, we've already expected over $70,000 worth of revenue in less than 90 days here. So
That's net revenue, Chief.
net revenue, yeah, net revenue. I'm sorry, the net revenue piece. We've billed hundreds of thousands. I don't know the number exactly, but this busy year those graphs we talk about with wildland billing and all that stuff will be another large year at the pace we're going. But we've already exceeded our net revenue for the year already. You may have read in the newspaper, I believe in today's paper on the back, if you noticed, they talked about the national perspective that they've spent over $2 billion on the federal wildfire side of things. Banner year, the most they've ever spent and things like that, and 13,000 square miles of fire and over 48,000 fires this year. So busy year, and there's global impacts, there's federal things going on. There's a lot of stuff happening. So we're, as Jeff said, doing our part at our level and participating where we can and things like that. I think I shared a letter with you via email just from the Forest Service, just saying, hey, we really appreciate the the efforts and the things, at the time, 18,000 firefighters, I think, like Sedona firefighters were contracting with the federal service at that time. So it just gives it perspective of where we are in the big picture of things. So we're doing our part, and we're active and engaged where we can be and should be. So thank you to all the guys and folks that are out there doing that. So
Chief, what is our normal commitment to send someone out to when we send people out to maintain that balance, to still keep our home front safe? 4, 6, 8 people at any one given time on average?
We take into consideration hunting season, vacations, and the like, but generally it's anywhere from 6 to 8 people before we really start getting strapped. If it's in-state or neighboring community, we'll send folks out as best as we can, and maybe a few more folks than that, knowing that it's desert fires and they're over quickly and they can return back home. But on the out-of-state responses, 6 to 8 folks it's the comfort zone.
I think the other piece to that is that we also look to balance who's available and what shift they're on. So we don't have 6 or 8 people all from one shift, so that also is a variance. So who's available, who's not, and what shift they're on. So it fluctuates a bit and is a constant balancing act that's going on over there at the operations chief's office all the time, so that's good stuff. With that, I think the last thing on my list to talk about, I have nothing else on the chief's report, I'm sorry. So I'll move on to the next when you're ready.
Okay. Benny, this is next, the Wellness Council?
No.
I got one over here. Yep.
Would you slide?
Oh, yeah. Oh, you got it over there? Yeah, sure.
Okay. So we'll just look at a couple slides here. We were honored last week at the Wellness Council luncheon, annual luncheon, but I wanted to share with you kind of how we got there. So we work with an organization called Benefit Commerce Group. They are our insurance broker, and they help us not only connect with the insurance providers, but also look for ways, as you know, to reduce cost of our medical insurance program. And I just wanted to show you on this slide that there has been, since FY16, a reduction, slight, but a reduction in our medical costs for the employee-only spouse family, just to show you across the board. Up to FY15 and then to 16, it was an increasing amount. And since 16, we've seen now a decrease. But as you know, and we've talked about this at former board meetings, we've done some activities under what's called the trend neutralizer to help us reduce those costs. So our next slide is going to show us what some of those things are that we've done and where we get our credit. We have employer-sponsored wellness events. We do the biometric screenings and physicals. We have a health risk assessment that employees complete online through the Blue Cross website. We're getting credit for each of these things off our premium costs. There's a disease management program where employees are encouraged to talk to a coach about whatever disease situations are going on. We implemented at the end of last year the tobacco rate differential. So if people are using tobacco, they are to pay a higher rate on their contribution for their medical insurance premiums. And of course, all of our programs are the high deductible plans where there's a health reimbursement account or a health savings account attached to that. So these are the parts and pieces that allow us to give us a 1% credit or a 0.5% credit or whatever. And that has led us to those reductions for 2 years now. More about the organization, though. This Wellness Council of Arizona is a leader. They started out in Tucson, Wellness Council of Tucson, and then they grew to become the Wellness Council of Arizona. They've got a lot of organizations that participate. A lot of the brokerage firms participate and sponsor, and they do an annual luncheon. We won an award, and I'll show you this first one, is the Process, Progress, and Leadership in Worksite Health and Promotion Award. And actually, it's the second year for us. The first year was Process and Leadership. Because we've shown demonstrated results, now we've added progress. We can demonstrate the progress. So I just wrote up on that slide some of the things that they measure. We've got an established infrastructure of worksite health, a culture where senior management participates. We value employee input and the delivery of the engagement, a design program. And that last bulleted item at the bottom, documentation of outcomes based on parameters, that's where we're following the trend neutralizer and showing demonstrated progress in our wellness initiatives. That was one award that we got, and that's for the organization. The next slide talks briefly here about an individual award. I was nominated as Wellness Committee Champion and received an award. Now, we'd like to think that I was the only one in that entire luncheon of 350 people who got that award, but no. There were a total of 123 awards given out, and I was one of, what would you say, 30 up there in the crowd getting this one? So one of 30 getting this champion award. Woo-hoo. Oh, thank you. Oh, thank you. Thank you. No, it's because of all the activities we do here. So just to let you know, I'd mentioned what those 10 trend neutralizer items were. What have we done specifically in this past year? Well, we've had multiple healthy potluck lunches. Any of you been to a potluck lunch here? Yep. The promotion of the wellness education via monthly wellness flyers. We had a Name the Wellness contest, and if you remember on that first slide, I had the Living Well. Living Well, the employees decided was a good name for the wellness program, brand it. We do the biometric screenings. We did that last year in December, and all of our ops folks go for their annual physicals. We did, as I mentioned, implement the tobacco differential rate program at the end of last year, but we got credit for it for this year's premiums, which is good.
I'm curious about that. How has it created some people quitting?
Yes. I would say it's been about 5 to 6 people between January last year and July 1. We gave them a 6-month lead up to reduce or stop their tobacco use so they would not get that rate differential. And we are now surveying everybody again, having them sign the certification that says I am tobacco free, and everything that's coming in so far, we're in the middle of this, is tobacco free. So we're not having to assess anybody. The credit that we get on the rate is not for people who have stopped the tobacco. It's for implementing the program. So that's good. And then the access to the disease management.
So if I could just share on that, though, what we found also, many of our employees actually expressed appreciation. Like, I really have been wanting to quit, and this has given me a really good reason to quit, because I don't want to pay more than I want to. And so it was viewed upon as a good incentive to cause them to quit. And it follows federal guidelines and things like that as to what qualifies as a tobacco or non-tobacco user and things like that. So.
It's really good to hear. You know, I was a little bit skeptical when this was announced, Betty, before, and I wasn't sure a negative reinforcement would be as successful as a positive one. But gosh, that's incredible that they've quit smoking. It's a hard thing to do,
And the fact that as of July 1, we were 100% tobacco free. So that was good. It wasn't as though we had to charge 1 or 2 people. And then if we'll go to the next slide, there's the photo of Chief, me, and David Spelsey from Benefit Commerce. He is our champion in the insurance arena and the wellness arena. So it was nice to be able to sit at his table and participate in that event at his invitation. One more thing. So I've told you what we've done up till July 1st. So now we've been doing some things as of July 1st in this new fiscal year. We've held 2 challenges. One was a hydration challenge where all employees were challenged to drink more water and record that water for a month's period of time, and then turn it in, and then we were to draw, and we did draw some names to win gift certificates, gift cards, if you will. So we did that. We then had in August, Eat the Rainbow Challenge, and that's where folks were challenged to eat different colors of fruits and vegetables as much as they could and tally those up for the month of August. And we had 3 winners of that contest. One of them's in the room right over there, Tricia. They got gift cards, and you're thinking, wait a minute, oops, congratulations, Tricia. Where's that money coming from for those gift cards? You're handing them out like water. Well, Blue Cross has offered to us $2,500 this year in wellness incentive money to do these types of challenges to incent people through however we want to do it. I'm doing gift cards to get people to participate in the challenges. We also have the biometric screening, which is next week, so we're doing that earlier this year. And we've got people filling out the tobacco forms, which I told you about. So this 6 months is all about wellness and moving these programs along so we can get our credit for next year.
So that credit is up to 10% on the increase. So we can see up to a 10% reduction by each of the different levels. And some of them are, you have to have 100%, and it's hard to get 100% of anything. But some are 2.5% reductions. So the fact that we have an all high deductible health care plan is a 2.5 guaranteed 2.5% reduction just there if we did nothing else. And then when you add in the, 50 to 75% or whatever the numbers are in the tobacco use or the, whatever they are, you get these, up to so many percent, and you add them all up. If you got 100% on all of them, you get a 10% reduction, which is why we've seen that reduction in the last 2 years combined is about 2.9% or 2 point something reduction
A
overall.
net 2.9, but we had a 6.5% credit, I believe, from the end of this last fiscal year, which rolled over into this year's premiums. And that was offset by, I think, a 5.5% increase in our rates.
Yeah, it's like a
So we
1.9.
netted that little reduction, that 1% reduction on everybody's costs.
Every percent cost.
Yep. Any questions about wellness and where we're going? Okay, thank you.
Thank you.
So I'd like to definitely recognize Betty for her hard work. She does set all these things up and get all the emails out and wrangle all the cats that we have to get this to happen and come to fruition. But at the end of the day, it's about taking care of our employees and making a difference. And so I was honored to be there on Friday and watch Betty win one of the prestigious awards in a very nice framed, suitable for framing certificate. And so, and I think the last thing just to say is that Benefit Commerce and Dave Spellacy, as Betty did mention, is also a champion. Him and the company he works for, we're very active in this a seminar or a luncheon, the awards. And remember, we were the trial for the trend neutralizer program. That we were the first people in Blue Cross's Blue Shield's history to ever get a trend neutralizer ever. And so I think it just illustrates our commitment towards trying to be best practices, do what we can do to make things the best and fiscally and health and everything. We look at it at every level, and this just illustrates that in this particular piece. But I certainly applaud Betty and everyone in the organization for getting their physicals done and getting their biometrics done and the questionnaire done and following up with a coach and all those things that are really for their benefit. And it also benefits us and the taxpayers when we go to do our renewal, because if our employees are healthy, we're going to see a better renewal. It's a win-win-win. So thank you, Betty, for your hard work in this program and our partnership.
All right,
So we
thank you. Next item is a purchase order, Kronos.
Me?
This is a renewal as well as an upgrade for our scheduling program that the firefighters utilize and we as management use for tracking and payroll purposes. It's going off a server base into a cloud-based system, which will help us reduce our overhead cost and maintenance on server pieces. But in order to do that, we have some one-time expenses to bring it along, as well as some licensing pieces that come along with this. So the provider, which is Kronos, the cost is $36,758.47. It is an existing vendor that we're utilizing, and it is an update to their systems.
And it is a budgeted item,
It is budgeted.
not to exceed 40.
Yes, sir.
And that not to exceed is there's some travel training pieces that we don't have the numbers for, so that's why we wrote it that way.
Any questions or motion?
I'll make the motion. I move to approve purchase order number 10962 to Cronus in the amount not to exceed $40,000 as budgeted.
Second?
Okay, any further discussion? All in favor?
Aye.
Okay,
Wow.
Before John starts, I think it'd be appropriate to acknowledge John today. It is the anniversary of his birth. We'd like to lead in a song of happy birthday. Cammie, will you start? No. Happy birthday to you, John.
Thank you.
And I hope you enjoy your vacation.
Yes, I set a new personal best for most consecutive years lived, so I got that going for me today.
is your message tonight going to be about the number of candles that will be on the calendar?
No, we're not even gonna get. I looked up something last night. It was talking about the day you were born, and it gave me the total number of candles that would be on my birthday cake if we counted them from year one up to now, and it was 1,362 candles total. So that's more than anybody needs. So yeah, the coming up in the week of October 9th, we've got Fire Safety Week, Fire Prevention Week, and the theme this year is every second counts, plan 2 ways out. And this is something that's been studied quite a few different ways, but people will walk, and when they're in an unfamiliar environment, in a stadium or restaurant, they will actually walk past an exit towards an area of increased danger to go out the way that they came in because it's familiar to them. It's second habit to me now. When I go into a place, I look, I see where's the way that I came in and where's the closest way to get out. It's just a good habit to get into. People in the station fire back in Rhode Island died because they tried, instead of taking the nearest exit, they tried to go back the way that they were familiar with. So every second counts, plan 2 ways out.
Okay. All right. Is this a record? I think this is a record. All right. Thanks, everybody. Have a wonderful night.